on Facebook.
Yeah.
Good day, everyone. Hi, everyone. I'm Olajumoke Shojimi, the MD of Unicare Global Limited, Apollo Hospital Information Center. And here with me is Dr. Prasad. He's our senior consultant with over 20 years experience. Dr. Prasad is a skilled and dedicated medical oncologist with extensive experience in treating head and neck, breast and gynecological cancer, having a trained and work in eminent institutions both within India and internationally. He has been awarded with several fellowship awards internationally and has also led various successful clinical trials for which he was awarded with national honors. His passion for comprehensive oncology care is coupled with his belief in improving quality of life in cancer patients. Thank you, Doctor, for coming. Thank you for joining. We are
Thank you for the
privileged.
introduction.
The topic before us today is comprehensive insights to breast cancer and treatments. So before we go on, I would like Doctor to just say one or two things before we go on. Say one or two things to everyone. People are watching out there.
Uh, uh, Good afternoon, Nigeria. I'm Dr. Prasad. I'm a senior consultant oncologist in Apollo Cancer Hospital in Chennai. I am here to help all the patients, all the people create awareness about breast cancer because whenever I travel, I see a lot of young women diagnosed with breast cancer. So breast cancer awareness needs to be the need of the hour. So I'm here with the famous person from Nigeria to help create awareness among young women to make sure they do a proper screening and prevent breast cancer.
Thank you, sir.
So
Hello,
generally,
Doctor.
but do we have any questions till the audience come up with any questions? We can have a general discussion about breast cancer. Huh?
Yes,
So let me give the my experience of how we had evolved in the past 2 decades. So 20 years ago, when I was a student, breast cancer patients were all in their 60s, 70s. We were not seeing any young breast cancer patients 25, 30 years ago. But now I do have patients who have come from Cameroon, Angola, Nigeria. They are in their 30s. The youngest patient who came from Nigeria was 32. It is going to be a very, very difficult decision regarding the treatment plan. When they are just 32, when they have just finished their college, when they have to concentrate on their career, family, marriage, children, it's going to be a tough thing. So basically what we need to do is create awareness. Any young women who needs to be having a suspicious lump in the breast needs to be properly evaluated. That is done by doing a self breast examination. You don't need to go to a hospital. You can do it in your own home, just in front of the mirror. Stand in front of the mirror, braces off, just compare both the sides. Just see your breasts. If they're all equal, that's good. Then try to touch and palpate, maybe with the palm and the fingers. Try to rotate all the parts of the breast, top, bottom, left and right. That has to be repeated again on the opposite side breast, top, bottom, left and right. Do a circular motion in each of the quadrant to see if there's any lumps or bumps present. If you could feel anything different from this side and the opposite side, then meet a doctor, get a proper evaluation by the doctor. Mammograms are going to be very, very useful in the situations. Just an ultrasound, you don't need more. Just a simple ultrasound should be able to differentiate between different types of breast lumps. That guides us how to proceed further. That will help to diagnose or screen if there's any abnormality. And once you have any abnormality, the doctor will guide what needs to be done, probably with a biopsy or further investigations like a proper diagnostic mammogram or some advanced scans like CT scans or PET CT scans. This is the basic evaluation that any woman needs to do. Breast self-examination is the key to screen breast cancer. You don't have to go to the hospital. It is all done at home in your own place. Whoever is watching this video, try to learn how to do it. We would be able to post most of the videos. They're also available online. Examining in front of the mirror, checking both sides visually, as well as examining by a simple palpation. Just touch, rotate, and up, down, left, and right. The other side, up, down, left, and right. Just check, and if there's anything, go to the doctor. This is going to save a lot of young Nigerian women. Any questions?
Okay, before we start asking, maybe checking on the questions that is being put on the comment section, what are the signs and symptoms to always look for?
Okay. When we are looking at the signs and symptoms, breast cancers or any cancer will not produce any symptom when it is very small. As the tumor starts to grow, as the size of the lump starts to become bigger, it produces symptoms in the form of breast cancer presenting as breast pain. Sometimes it can have a little bit of bleeding in the nipple. Sometimes it can present as any of the swellings in the armpits. So all those would be the initial symptoms for breast cancer. Then if you feel like a breast lump or a lymph node in the armpit or any swelling in the neck, that means the breast cancer lump had spread to the armpit nodes as well as the neck nodes. But do not allow till you reach that stage because that means a little advanced disease. But don't lose hope. There are always medicines available with the right information and the right direction. You can win cancer. But nevertheless, catching the disease in a very early stage makes a lot of difference in terms of lesser treatment, simple surgeries, and easy recovery. Nobody wants to have the breast removed when they are just in their 30s and 40s. Advanced breast cancer needs a complete breast removal. Early breast cancer does not require breast removal. It just requires only the lump removed. So the women does not have to lose the breast. We could still go for a breast conservation surgery. There should not be any cosmetic difference between the operated side and the normal side. Simple surgeries are possible when the diagnosis is made early. Number two, there is no need to go in for extensive chemotherapy long courses of chemotherapy regime. Early breast cancers can still be treated with simple tablets. We don't need to have multiple chemotherapy or multiple combinations of chemotherapy. Early disease can be simply treated with just short course of treatment. Number three, early breast cancers may not even require radiation. It could simply be treated with surgery, simple form of chemotherapy or hormonal tablets, and only in specific cases there would be indications for radiation treatment also. So the entire treatment is short, it is all curative, and when diagnosed in a very early stage, patients live longer. They don't have to be worried about breast cancer recurrences as well. Any questions?
Thank you, doctor. Can you hear me, doctor? Can you hear me, sir? Can you hear me? There's another question here from our viewers. Doctor, can you hear me? Can you hear me, sir? Can you hear me, sir? Can you hear me? Can you hear me? There's a question from one question from our viewer.
Yeah.
The question is okay. Thank you. Yes. Go back. The question here is: will breast cancer affect breastfeeding?
See, I will answer it in two ways. Breast cancer does not affect breastfeeding, but only if you have a breast, you can feed the baby. For example, if the lump is this big, the surgeon needs to remove the entire breast. So only a scar will be present. But if the diagnosis is made when the lump is only this size, the breast needs to be removed. If it is only this size, the breast can be conserved. There is no need to remove the breast. And the women can continue with the normal breastfeeding because it's only a part of the lump and the surrounding normal breast tissue is removed just to make sure that the cancer doesn't recur in the breast. So breast cancer as such does not affect breastfeeding. On the reverse, if the women had breastfed their children for at least 6 months to 1 year, the breast cancer recurrence is reduced. The risk of developing breast cancer is very, very less in women who breastfeed their children. So, in fact, in our clinics, we would ask whether the women had number of children and the number of years the women breastfed their children, because that reduces the risk of somebody getting breast cancer.
Thank you, doctor. There's another question here. Thank you, doctor. There's another question here from our audience saying that in which stage breast cancer can be cured? The stage where breast cancer can be cured. The
Yeah.
stage.
So in general, breast cancer or any cancer has four stages: stage 1, stage 2, stage 3, and stage 4. In stage 1, 95% of the breast cancer patients are cured. In stage 2, approximately 75 to 80% of the breast cancer patients are cured. In stage 3, approximately 20 to 30% are only cured. So there is a drastic difference, drop in the cure rates between stage 2 and stage 3. Even in stage 4, 5% of the patients do survive beyond 8 years. So there is a recent trial which says with the better medications available, with the access, breast cancer can be cured even in very advanced stage. So there is a group of aggressive breast cancers called HER positive breast cancers. For women who had a stage 4 HER positive breast cancer, when we use the latest treatment as per the guidelines, 37% of the women are alive at the end of 8 years. So right now there is a trial which had followed up advanced stage of HER2 positive breast cancer patients, and they were followed up for close to about 8 to 10 years. And in that group, close to about 37% of the women were alive, even in stage 4. So what I wish to say is, even in stage 4, there is a possibility of long-term disease control and cancer survivorship. But do not become a stage 4 patient. Try to diagnose when it is still in a very, very early stage, probably stage 1 or stage 2. We don't want the cancer to spread to all parts of the body and then land up with a difficult disease. And in stage 4, you have to see the doctor every 3 to 4 weeks for depending upon the treatment. We don't want that. We just want our patients to be happy, alive, without disease. We want you to visit us once a year just for your checkup. More than the patients, doctors would be the happiest persons to say, Miss X, Y, Z, or whoever it is, you are a cancer survivor, you are cancer free. That gives the doctor the happiness. Screening is the best way to prevent cancer.
Thank you, doctor. Thank you. There's another question here from our viewers. Will chemotherapy and radiation therapy affect pregnancy? Will
So
chemotherapy
usually
and radiation treatment affect
radiation
pregnancy?
therapy affect pregnancy. So
And what are
usually
the
we
options for
yeah
cancer?
usually we take a lot of precautions when we treat the cancer patients. We do not give chemotherapy for somebody who is in the first or the second trimester. Even in the second half of the second trimester or third trimester, we have some medications which are safe to be given during pregnancy. For radiation treatment, there are a lot of techniques available. Say, for example, electron beam therapy, proton beam therapy, brachytherapy with abdominal wall shielding. Breast is in the thoracic cavity. The baby is in the abdomen, in the tummy. So there are techniques where we can shield the tummy. We can shield the radiation to the baby and then treat only the breast. But it's a very, very difficult thing. So generally during pregnancy, we have safe medications which can be given for cancer,
All right. Thank you, doctor. Thank you. Okay. Let your question keep rolling in. Okay. There's another. Can breast cancer be 100% cured? Someone wants to know if breast cancer can be 100% cured.
So it all depends upon the stage of breast cancer. Stage 1, there is a 90-95% cure rates. Stage 2, 75 to 80% cure rates. Stage 3, about 30 to 40%. Stage 4, close to about 5%. But we want all our patients to get cured. So we use the best medications for a good outcome. The main problem is the accessibility to a good medication. Most of the drugs which are new, which are very effective and can have a good control over the disease is very expensive. So we are trying to subsidize the cost of the treatment to make sure everybody gets the best treatment. In India, we do have a lot of infrastructure in the manufacturing sector, especially in the pharma struct sector, where the the advanced medications are manufactured and given to the patients at a very, very cheaper cost, well as pricing. So patients are able to take all those advanced medications at a cheaper cost. So when there is an access, when the drugs are affordable, we are able to cure a lot of patients even in advanced stages.
Right, thank you. Do men get breast cancer like women?
Yes, but in a very, very small percentage. So there are some genetic factors which play a very important role for men who develop breast cancer. There are some genes which are at a defect. They are called as the BRCA genes. When somebody has the BRCA gene mutation, men can also get breast cancer. But the breast cancers which happen in men are more curable or hormone sensitive, and specifically when the BRCA mutation is present, they need to be properly screened because BRCA mutation can cause a multiplicity of cancers. It can cause breast cancer in men, it can cause prostate cancer, pancreas cancer, and multiple other cancers as well. So when somebody has a family history of cancer, they need to be properly screened. They need to be followed up with a periodic evaluation with probably an ultrasound or a CT scan to make sure those patients do not get cancer. If there is a suspicion, Surgeons are called for a intervention, and they would try to remove the tumor when it is still in a very, very early stage. So everything points to only one thing: screen yourself and avoid getting cancers. Screening plays a lot of importance in the breast cancer treatment.
All right. So, what are the causes of breast cancer, both in young and elderly people? The causes
Sorry,
of
come
breast,
again.
the causes of breast cancer, both in young and elderly people.
Yeah, causes of breast cancer is predominantly hormonal. If you are a woman, there is a risk of developing breast cancer as the age increases. More years of estrogen exposure. For example, nowadays young girls are attaining puberty by the age of less than 10, and they are continuing to be menstruating till they are about 50 or 55. So when there is a long duration of menopause, the same, I mean, the menstrual cycles, 40, 45 years of hormonal exposure, there is a chance of developing breast cancer. Nowadays, women also take hormone pills, obesity, high fat diet, lack of exercise. Women postpone their pregnancy, sometimes do not even get married. So we call it as nulliparous. They do not give birth to the child. Even if they give birth to the child because of their career, because they need to go to their office, they are not able to breastfeed the child. All this cumulatively increases the risk of a woman developing a breast cancer. So these are all the risk factors. Along with that, the family history, the diet that we are taking, pollution, all would add up. Smoking increases breast cancer. Nowadays, I could see a lot of women smoking, taking alcohol. All these parameters are changing the way women get breast cancer. So these are all the risk factors which needs to be kept in mind, and patients needs to be properly educated. Awareness creates a lot of things in preventing cancers. It's not just about breast cancers alone. It's about having a healthy lifestyle. Nobody needs to have a heart problem. Nobody needs to have a lung issue. Nobody wants to have any cancer problem. How do you make sure nobody gets sick? It's healthy lifestyle. Exercises improves the overall well-being. Less fat diet. A diet with more of fruits and vegetables. A diet which has less carbohydrates and more protein. A diet which has less red meat, definitely with more vegetables, changes our hormone levels also. It decreases the fat content in the body. Fat gets converted to hormones, especially the steroidal hormones. So when the body fat is in a control, then there are less chances of developing cancer, especially the breast cancer. Obesity is playing a very important role in developing cancer. How can you combat obesity? By doing exercises. Exercises reduces the stress hormone levels. It keeps the body fit. Overall outcomes when a person is doing exercise is very, very good. There are less heart problems. The patient's stamina is better. The bones are stronger. And overall, the person lives longer. The person does not become a patient when they do proper exercise. So there's a lot of lifestyle managements which can be done to prevent cancer in the person.
Good. Thank you, doctor. Thank you. So, what are the treatment options, sir?
So a lot of treatment options available for breast cancer. In the sense, when somebody is presenting in a very advanced stage, surgery, chemotherapy, radiation, hormonal tablets, targeted therapy, all these medications needs to be given. When somebody is diagnosed with an early stage, patient would undergo surgery, limited courses of chemotherapy, shorter dosages of targeted therapy, and longer duration of hormonal pills that prevents cancer. So you don't have to visit the doctor. When diagnosed in a very early stage, the treatment is going to be a simple surgery and somebody will take pills every day. The treatment is very simple. Radiation is also for advanced breast cancers. For early breast cancers, we choose who needs to get radiation and who can omit radiation. There are a lot of subtypes of cancer. There's a lot of under breast cancer, wherein we choose who needs to get what kind of treatment. 25 years ago, all, all breast cancer women were getting chemotherapy. Right in 2024, only about 30% of the patients, one third of the patients who come to my hospital will get chemo. The others can be treated only with small tablets. How do I choose? We have some better understanding of breast cancers. We do some molecular testing. We know what is causing the cancer by doing the molecular test. When we do a molecular test, we will know whether the patient would benefit with chemotherapy or chemotherapy can be safely omitted. So in those patients, there is no need to give chemo. We can just put them on hormonal tablets and send them home happily. They just need to come for a visit for follow-up once in 4 to 6 months. Usually, the cancer patients are screened every 4 to 6 months in the first 2 years, every 6 months in the third and fourth year. Fifth year and later, patients are screened only once a year, just like a normal screening. We would give them a plan to do proper checkups in their own country, and they send the reports to us by email. And that's how we treat cancer patients.
Wow, I believe our viewers are really enjoying, and I believe that is more educative. They are really enjoying this program, this moment with Dr. Prasad. Dr. Prasad, thank you, thank you, thank you, thank you. Now I have another question here. Is breast cancer treatment expensive?
Not at all, provided you come with an early stage breast cancer. If it is going to be an advanced stage breast cancer, the treatment is long. A surgeon, medical oncologist, radiation oncologist, all of us would be involved. Because when the disease is advanced, stage 3 or stage 4, we need a lot of chemotherapy, we need a lot of targeted therapy, immunotherapy, radiation, surgery, everything is involved. If it is a very early stage, say stage 1 or stage 2, the treatment is going to be a simple surgery, simple form of chemo, shorter course of targeted therapy, and hormonal pills. There is a huge difference in the cost of the treatment when somebody is diagnosed in a very, very early stage. Breast cancer treatments were expensive in the past, but right now, at least in India, we are the manufacturing hub for a lot of medications and we export them to all the European countries. And unfortunately, the European countries sell it back to the other countries at a very exorbitant pricing. So when we are looking at the cost of cancer treatment, medical tourism definitely helps the patient. You just need to travel to a place where you get the good quality of care, where you get good medical facility and cheaper medications. For patients who are coming to Apollo Proton Cancer Center, they just get the first cycle of chemotherapy with us. I would usually observe them for their side effects for the treatment for the first cycle of chemotherapy. For the remaining course of the treatment, patients from Nigeria, Cameroon, Angola, or any other African country, they buy the medicines from India, go to their own treating physician or the treating doctor with the treatment plan. We would give them a treatment plan. Say, this is the date you need to do a blood test. This day you meet with the doctor, and this is the day you need to have the chemotherapy done. These are the side effects after undergoing chemotherapy. Everything is put out on the paper. We give them a facility for teleconsultation as well. So overall, these patients are followed up during their entire course of treatment, even though they go back to their country. And they complete the course, then they come back for their treatment, for in terms of either surgery or radiations. Overall, the cost of the treatment is going to be lesser. Of course, it is going to be there, but it is lesser compared to what they would spend in their own country. Because there are certain medications which are very expensive in other countries. But India being the manufacturing hub, the cost is way low. So in that way, we are able to help not only Indians, but anybody who comes to India to seek medical help. There is a saying, Atiti Devo Bhava, in the sense, guests are gods. We treat our guests with respect, we treat them with lot of love and care.
Yes. All right. How often do we do mammogram?
Right. Any any women, be it an American, African, Indian, or an European, any women more than 40 years of age needs to have a mammogram once a year. This is the universal guidelines. When there is a suspicion of a family history of cancer, for example, the grandmother would have had cancer, the daughter would have had cancer, the granddaughter is at risk of developing cancer. So in that case, the granddaughter should start screening from the age of 25 to 30 years. Normal guidelines would be to do mammogram beyond the age of 40. When there is a family history or high risk group, they need to start screening from the age of 25 to 30 years. And that is the standard guideline.
Good. Thank you, sir. Wow. Wow. This is educative, very informative. Thank you. Thank you. Thank you. Is there any side effect in breast cancer treatment? Is there any side effects?
So usually the side effects which are involved in the cancer treatment are temporary. In the sense, when chemotherapy is given, it can cause hair loss. But the hair will grow back. When the chemotherapy is given, there is a slight reduction in the immunity. We do have immune booster injections to boost up the immunity. When somebody is getting chemotherapy, they may feel a little tired. We would ask them to have a high protein diet, drink a lot of water, and have regular exercises. A toned up body will not experience fatigue. So all these are the small side effects of the treatment, but generally we have remedy for all these things. Some patients can have vomiting, but we do have medications in the form of simple injections or even tablets to make sure that the patient does not have vomiting after chemotherapy is given. We are right now in 2024. We have a lot of newer medications available. Cancer treatment can be safe, simple, without major side effects.
All right. Doctor, most people believe that when they hear about breast cancer, they believe it's a death sentence. So when they hear about breast cancer, they believe they have a low lifespan, that they have limited time to live. Is that saying
Mm.
right?
That's a myth. That's a myth. Cancer is not a life, it's not a death sentence. Cancer patients can live longer. Cancer can get cured. Cancer patients can lead a normal, healthy life, provided they get the right treatment from the right person at the right time. Time, place, medications, and the outcomes definitely matter. Nowadays, most of the cancers are curable, not just alone breast cancers. There are a lot of cancers which are curable. The only thing is somebody should need to have a proper guidance. They need to be in a place where they have access to the advanced treatment and where they can afford the treatment. All these matter in the treatment of cancer. There are so many medications available. So imagine when I started my oncology training 25 years ago, we hardly had any medicines in India. But now there are a lot of newer medications available in India. Access is made easy. The cost of the medication is very less. The patients are able to buy the medications and continue it for a longer period of time. So overall, we are able to conquer cancer by treating them right, providing them the best care, and offering the best quality of care. Nowadays, we are even getting patients who are coming in from Europe and US to India for their treatments because the cost is less and they get a better quality.
Yes, I was about to ask that question, Doctor, before you mentioned it. I was about to ask you because somebody also asked that question. That was the comparing the cost in India to Western countries. Um, how is it? Is it lesser in India or more expensive in India? Comparing the two together, can you please help us through light to it?
See, at least in my hospital, we do not differentiate between Indians and others. We treat everybody with the same treatment. We treat them with respect, love, and care at the same cost. We do not charge them extra.
Yes, yes, you're right, Doctor.
Mm.
You're right. Apollo Proton Cancer Center is really doing well. Yes, yes. Thanks to them.
Thank you.
Is breast cancer treatment painful?
Breast cancer treatment?
Is it painful?
Not at all. We would never do anything which causes discomfort to the patients.
Okay.
The treatment nowadays are much simple, lesser side effects, and more patients are able to complete the whole treatment. That's the wonderful part of it. Patients are see, now getting the advanced techniques. There need not be any IV injections nowadays. We just give the treatment for breast cancer like a subcutaneous injection. In the sense, we just give an injection under the skin, just like how the insulin injections are given for diabetic patients. We do have some medications which can be just given under the skin. It can be given in the tummy area. or the thighs or the upper arm. Most of the medications are now available as tablets. So overall, there are less side effects, and the targeted therapies are available which would specifically target only the cancer cells. So all these newer treatment options have completely changed the way we treat cancer. In the sense, it has very less side effects. It does not cause much discomfort to the patients. I have few patients who are coming for the treatment for the past couple of years. They just come, get their treatment finished in about 30 minutes, and go to their offices.
Wow.
They come at 7:30, finish their treatment by 8:30, and reach their offices by 9:30. So cancer treatments are now easy, accessible, affordable, and more to say, simple. It does not affect the normal routine daily activities.
Good. Good. Our viewers at home, if you have any queries, if you have any reports, and you want doctors to give you opinion, please, you can call 080-871-56076. Also share the phone number on the screen. You can call the number and send those reports to that number, and our doctors will give you an opinion on those reports you'll be sending to us. Thank you. Doctor, over to you now. I have a question here. What is PET-CT in cancer treatment?
Yeah, just to make you understand, what phone did you have in 2004? Can you tell me? What was the phone that you had 20 years ago?
Nokia, all this Nokia.
Right. 2014, what phone did you have?
Blue, is it blueberry? Blueberry.
2024. What
Yes.
phone do you have?
What year, sir?
Yeah. So what is the difference? That's all the technology, right? So we moved from a black and white TV to a big color TV to a LED
Yes.
TV. Now we have 75-inch, 85-inch, ultra thin, AI. That's the technological evolution. Similarly, when we are looking at the scans, you remember we just had started only with an X-ray, then
Yes.
an ultrasound, then a CT scan, and now we do have a better modality of cancer screening called the PET-CT scan, which can tell us where the cancer has spread, what is the size of the cancer, and also whether the cancer is alive, multiplying, and actively spreading. So these are the latest scans which are now available almost all over the world. There are a lot of countries which do have PET-CT scans, at least in their capital cities. I think Nigeria does have a PET-CT machine in the teaching hospital, and there are a lot of your neighboring countries as well having the PET-CT scans. But the world is moving forward. We are moving beyond PET-CT scans. Not just PET-CT scans, we are also moving towards PET-MRI. There are a lot of newer developments which are happening in the diagnosis of cancer. With more and more technological advancements, we are able to understand the cancer better. And more we understand the cancer, we are getting to the bottom of it to eradicate cancer. A lot of newer treatment options also coming because we are able to understand the cancer better. So I hope I had made you understand how this PET
Yes.
scan is making a lot of difference in the treatment of cancer patients. So it's the newest technology. So anybody asking you what is a PET scan, give them this example of the black and white TV, color TV, and what we have right now at home. That's a simple way to explain things to the patients.
All right. You've done justice to this. Thank
Yeah.
you. Question here to Doctor. What is the time duration of spreading from stage 1 to stage 4? Time duration.
Yeah. When somebody is not treated when diagnosed as stage 1, it generally takes about 6 months to 9 months for it to become stage 4. It depends on the cancer. It depends on various other factors. Generally, cancer is one living cell which tries to multiply, and once it's multiplied, it starts to grow and tries to spread. When a cancer is diagnosed in a very early stage, a proper treatment completely cures the disease. But if left untreated because of misguidance, because they do not have access, because somebody told them to take herbal treatment, none of the cancer cells listen to herbal treatments. They start to grow, and within about 6 months to 9 months, it starts to spread to other parts of the body. So we do not want to miss out on a patient's survival chances by allowing it to progress to a stage 4 disease. We want the treatment to be done at the earliest when diagnosed with a cancer and give them the best chance of cure.
Okay, there's a good question. Thank you, doctor. There's a good question here. Someone is saying that if patient wants to come to your hospital for treatment, how much will be the cost?
I think we do have the partners who help guide the patients to come to India. The number that you had said a little before would be the point of contact for the Nigerians to reach out. You can send the reports, and probably we would be able to have a teleconsultation. Now the world is in our phones. We can have a teleconsultation. We can guide them what needs to be done, and based on the decision, the clinical factors will be discussed, and then patients can plan to come to India.
Thank you.
Do you want to repeat the phone numbers? You can put it on the screen.
Yes. Can we all hear that there's free tele video consultation? Doctors will always be ready anytime when you send your reports to us to attend to you on tele video consultation. So you can send your report forward. I'm going to share the number on the screen, whereby for everybody to see so that there won't be any miss out from the numbers. So let's move on with the questions we have here. In case of reoccurrence of breast cancer, what can be done, sir?
See, even when the cancer recurs, there is still a chance of cure. So that's the reason we always say patients who are diagnosed with cancer needs to be on regular follow-up. When a cancer patient is on regular follow-up, we would do some tests called serum tumor markers. We do some tests called PET-CT scan, and if there is any suspicion of a disease reoccurrence, then we do a biopsy or start on with the treatment depending upon the stage of the disease. Generally, if the patient is on regular follow-up, they are diagnosed when the recurrence happens on a very early stage. If the recurrence is diagnosed in a very early stage, the treatment would be initiated, and we would do everything to control the disease and possibly cure the disease as well. There are a lot of newer treatments available as first line treatment, second line treatment, third line treatment, chemotherapy, first line, second line, targeted therapy, first line, second line, third line, immunotherapies, tablets. All these completely change the way we approach a cancer. We do have some biomarker driven therapies. All these are all newer treatments which are available for breast cancer, lung cancers, head and neck cancers, prostate, colon, GI cancers. So a lot of treatments have changed the way we treat cancer patients. So overall, we do have a good chance of disease control as well as a possible cure when the patient is on regular follow-up by doing some advanced testing. I always say prevent cancer by doing screening. And in cancer patients, a proper follow-up will prevent cancer recurrences.
All right. So we'll be taking our last question because it's now an hour now that we've been going on the um, moment with Dr. Prasad on breast cancer. So the last question here with me is, can herbal treatment treat breast cancer?
How about?
Herbal drugs. Can herbal drugs?
Sorry, can you say it again?
Can herbal drugs? Herbal drugs. Someone wants to know if herbal drugs can.
Can you put it in the chat box? I'm not able to hear you. Can you put it in the chat box, please? Can you hear me? Hello?
Hello, doctor.
Can you hear me?
Yes, I can hear you now. Herbal drugs. All these local drugs. Herbal drugs. Traditional drugs.
Herbal
Herbal
drugs.
drugs.
Yeah. No,
Can they cure?
no, no. See, uh, I mean, with due respect, at least in cancer, herbal drugs do not help. I'm making it very clear here. At least in cancer, with due respect to all the other alternate pathway physicians, herbal drugs do not help in the treatment of cancer. Please get the opinion of a qualified oncologist in a good teaching hospital in your own country to get proper treatment if there is a diagnosis of cancer. I again say herbal drugs do not help cancer patients. Please do not get misguided.
Thank you, doctor. You have really done justice to all our questions, all our doubts on breast cancer. Thank you so much, doctor. God bless you. Thank you. Namaste.
Namaste. Thank you so much, Nigeria, for hosting me. I'd be able to help you out. We should be coming to Nigeria often. We'll be able to help, and with the proper collaboration, with an affordable and accessible cancer care, we can win over cancer together. I would always say this African proverb: if you need to go fast, go alone. But if you need to go far, go together. We will go together. We will win
Yes.
over cancer. And
Yes.
the last message for the day would be start your breast cancer screening. Pink month is for breast cancer. That's why I'm wearing the pink shirt. Pink month is for breast cancer. Any women should have a breast cancer screening right from the age of 40 years. Men can also get cancer. Men should go for cancer screening from the age of 50 years. This is my message. Cancer screening prevents cancer. Stay healthy, stay happy, be happy, Nigeria.
Thank you, doctor. Thank you. I know
Thank you so
Nigerians
much.
out, they are really happy. Yes, they are happy. You've done justice to all the questions. And if you still have more questions, you can send it to the number on the screen. The number is on the screen. Show it on the screen. You can send all your doubts, all your queries, even your reports. Send it to that number or Junicare Global Limited website. Send it to there. Our doctor is available to attend to it, to send, give you his opinion over every report you forward to us. Thank you, everyone. This is the end of today's program. I believe there will still be more. You can watch out for more of this. Thank you. Bye.
All right then.
Nama.
Take care. Bye bye.